Hello and welcome to Mynahcare. The healthcare sector in India is one of the largest in terms of revenue and employment. The overall healthcare market is worth around $100 billion at present and is expected to grow at a compound annual growth rate of 23%. 65% of the market is comprised of healthcare delivery and pharmaceuticals. To understand the progress made by the industry and some of the challenges faced by it, we have with us Mr. Bhavdeep Singh, CEO of Fortis Healthcare. Welcome to Mynahcare, Mr. Singh. Let's begin with your plans for the coming year. What kind of expansion is Fortis Healthcare looking at, and how would you like to position Fortis Healthcare?
We are, as you probably know, Fortis is the second largest healthcare provider in India today. We have over 4,000 beds. From a growth perspective, we add beds every year, and I don't think this year has been any different. We continue to add beds this year. As I look at next year, into 2017-18, we have 150-200 beds that we're adding in our Bangalore hospital. We're adding beds in our Fortis Escorts hospital in Delhi. We're adding beds in Jaipur. So across our network, we have the good fortune of being able to add beds on within the existing four walls of the organization as it stands today. Apart from that, we are looking at a management contract model, O&M, operate manage model, and we believe we'll be adding beds on that front as well. So I think that on any given year, we expect to have 10-15% bed growth. And certainly, I think that'll be a good, healthy growth prospect for us as we go forward.
And I mean, technologically speaking, I mean, Fortis is already known for its technological advancements. Anything new in the coming year?
See, there's lots to be excited about in technology, and in the healthcare space. It's nice if we have good laptops for people. It's nice if we have good IT platforms, but quite honestly, in hospital space, the technology and the innovation that we're excited about is medical equipment. So we've added our first robotic program in October of this past year, and 6 months later we added another robot program in the Fortis Escorts hospital in Delhi. We believe we'll be adding a couple more robots as we go forward. We continue to be investing in our oncology program. So in Shalimar Bagh in Delhi, in Bangalore on BG Road, we're adding a brand new oncology block as well, which is full linac radiation, which is a significant technology investment. And we're also looking at bringing our first gamma knife in. So technology, really lots and lots of exciting stuff. It's just not always in the shape and form of a telephone or an iPad, or it's really in our business. It's about medical technology, because it's about how much more innovation can you bring towards improving the quality of people's health and people's lives.
Okay, this is your second stint at Fortis. What has changed? I mean, has there been a shift in strategy? How do you see it?
It's really interesting, the Indian healthcare environment. I've told people this often, that it's a bit like watching a Hindi movie. Sometimes you step out for half an hour, 45 minutes, come back, you really haven't missed a whole heck of a lot, and not that much has changed. So while India continues to change, continues to evolve, I think a few things have changed. One is that the awareness level and the education from a patient or attendant perspective is substantially higher than used to be, and that's obviously driven by the web, the internet information that's available. So people are very much, people rarely go to a doctor not having any clue what's wrong. They've done their research, and generally in India today, our communities are well educated. They want to understand what's going on, and they try to find out what's happening. So I think as a patient, as a attendant, I think people are far more aware in terms of what's happening. The second thing is that our brand is developing. I think 6-7 years ago, in my first round here, Fortis was primarily a northern brand that had strong presence here. But subsequent to that, we've grown. After the acquisition of Wockhardt, we have a strong presence in Bombay, we have a strong presence in Bangalore, and we continue to expand. We have a strong presence in Calcutta as well. So I think now we are a national chain. I think we're one of only 2 national chains, so I think the brand is significantly stronger as well. And I think the most important piece is that from a clinical perspective, I would put Indian healthcare, and having spent a good portion of my life abroad, I would tell you that I think Indian healthcare and our doctors are as good, if not better, than just about any place in the world. So I think lots of stuff is happening. We still have work to do on the PPO perspective, on the government public-private partnership perspective. I think we still have some opportunities there. I don't think that we've moved the needle enough there. I think we still have to figure out how to improve access. I think we've all done a little bit. Certainly we need to do there. So I think while some things haven't changed a whole heck of a lot, some things have changed a lot. And I think we'll continue to see more of that as we go forward.
As a sector, do you think it is like still booming, still showing a tremendous growth of rate, or is it in a consolidation phase?
You know, the good news, bad news there is that, so the answer is, from a organization company perspective, it is growing. It is growing, it's going to continue to grow. The bad news is that we are in the business of healing, and that comes at the expense of people's health. Unfortunately, the disease burden in our country continues to grow. So we are still dealing with things like dengue, which you would think that, collectively, the private sector, the public sector, that we'd figure out how to eradicate something like that. But we just dealt with a terrible, terrible strain of chikungunya in the past 4 or 5 months, and that's been challenging as well. Cancer, India is diagnosing 1.5 million new cancer patients every year. We continue to be the diabetes capital of the world. I heard a very sobering statistic the other day about cardiac disease, that in the next 3 to 5 years, as much as 2/3 of all cardiac patients in the world would be in India. So is the sector growing? Yes. Is it concerning? Is it concerning for all of us? Yeah. I think that organizations like ours have to play a role in wellness as well. And we have to help the country become more healthy. And certainly that's a direction that we are headed in. So again, that's the good news, bad news piece. I think we have to deal with the disease burden that the country faces.
And there you see an opportunity for Fortis, I mean, in creating awareness about, lifestyle diseases. I mean, a case in point is the organ donation drive that you've launched recently. Do you see Fortis doing more such stuff, which is like preventive and education? And
I do. I don't think that organizations like ours, I don't think we have the right to exist if we're not contributing to the solution. So I'll give you an example. Yesterday, we had a rally that was sponsored by our La Femme brand. La Femme is a Fortis brand, which is to raise awareness on breast cancer. The unfortunate news there is that 6-7 years ago, breast cancer was the number 4, number 5 cancer in India. Today, breast cancer is quickly becoming the number 1 cancer in India. And so raising awareness for women in terms of getting tested, getting mammograms, and having basic education, understanding of how to detect breast cancer, or at least detecting potentially an issue there. I think that we have to do that. So whether it's cancer, oncology, whether it's from a cardiac perspective, we have nutritionists in our hospitals that we are working on to educate around childhood obesity, around the kind of diets we have. Our diets are very rich, and I think very often we assume that just because we're vegetarian that we're prone, and that we're shielded. Actually, I'm sorry, we're shielded from any sort of maladies around the heart. But the reality is that given a vegetarian diet that consists of pakoras and vada pav and all these other things that we eat, samosas, etc., and these dals with lots and lots of tail and etc., quite honestly, that's pretty bad as well. So I think that building awareness and again moving towards having a healthier nation, I think that's in our best interest as well, so that we continue to build a healthier country as we go forward.
Let's talk about your recent drive on organ donation. I mean, 500,000 people die because of non-availability of organs. How do you plan to address this issue? I mean, of course, you're going to talk about the taboos associated with it.
So we've done, we picked up organ donation as an organizational cause last year. It's been about 9 or 10 months now, and the first to attack the challenge, as you rightly said, 500,000 people die every year because they don't get an organ in time. The first order, the first mandate for us is to build awareness and to build the organ donor base in India today. So in the last 7-8 months, we have 16,000 employees at Fortis. Over 5,000 employees have pledged their organs, which is a wonderful thing. Our goal is to continue to grow that number. And then, outside of Fortis as well, it's continue to educate people, help build awareness around it, so that people realize that any one of us can be organ donors. And it's not just in the situation where, God forbid, something terrible happens to us. We have family members, relatives, that might need organs. That we should be aware that how we can help people and how we can give and still continue to live full, healthy lives on our own. So I think we're working on building awareness. We're working on educating not just our patients and attendants, but even our doctors, even our nurses, in terms of how do you have that conversation. So I'm very, very proud of what the organization's done. It's an organizational initiative. There's no commercial end to it. This is not, I mean, Fortis will not make one penny. This is not about it at all. It's really about building the awareness, because this is the kind of thing that an organization like ours, it's really interesting, that if we can get 5,000-6,000 employees committed, or if we can raise the awareness of 16,000 employees, and they tell 10 people who 10 people, it's very conceivable that in the next 3, 4, 5, 7, 10 years, that you could actually have 1 million people walking around, living healthy lives that otherwise might not be. And that's a very powerful thing, and we're very committed to it. And I think you can look to Fortis to lead the way in India with respect to organ donation and actually moving the needle on it. Because if 5 years from now, if 500,000 people are still dying, then we've all failed. And my endeavor, our endeavor, every one of us, all 16,000 Fortis employees, our endeavor is to make sure that that number changes.
Mm-hmm. Okay, and pledging is one aspect of it, but exactly, I mean, how does it happen? Is our infrastructure ready? What would your wish list for the government be?
I think the biggest help that we need from government is, for example, there are states in the country that you still can't do heart transplants, right? So we'd love to be able to do heart transplants all over India. You can't do them. That's number one. So I think that from a government perspective, in terms of any restrictions that might exist, let's enable healthcare organizations that are qualified, competent, have the infrastructure resources. Let's enable them to be able to do that. That's number one. I think the biggest help that we need is infrastructure. The challenge is that in the case of a heart transplant, when you remove the heart, you have a very limited window to be able to get that heart from person A to person B. And it's not a 12-hour window, it's not a 24-hour window, it's a 3, 4, 5-hour window. And today what happens is we create green channels. We've all heard about the fact that a heart moved from Gurgaon to Delhi, or a heart moved from Andheri to Navi Bombay. That's good. Green channels are good. What we need, though, is a better infrastructure. We need, I think, the awareness level. Unfortunately, that all of us are immune to the sound of an ambulance behind us when we're driving. And instead of getting out of the way, very often you actually see people blocking ambulances. And I think raising that awareness and helping people understand that when you see an ambulance, it's about somebody's life. And let's get out of the way and let's do the right thing. So I think from an infrastructure perspective, whether it's creating special lanes, whether it's about creating any sort of vehicle, we've talked about having drones move organs as well. One of the biggest areas that we need help in is being able to move body organs from location A to location B in time, so that they can get to the person in time.
And earlier you were talking about the epidemic of dengue and chikungunya, which was really bad this year. How do you plan to deal with such a thing? I mean, if next year, God forbid, the same kind of situation. I mean, this year we saw hospitals overflowing with patients, simply not having the space or the beds. So how do you plan to tackle this at Fortis?
See, unfortunately, in the hospital space, we're really left in a reactive mode. There's very little that we can do. So we can educate. Certainly, we can educate people. We can talk about people being careful about how you should dress, how you should be, avoid areas, water, still water areas, etc. The reality is that apart from that, then it comes to education. Then it comes to not just educating our own employees, but our nurses, our doctors, in terms of how do you handle. I think very often that dengue has become it's become a dirty word in this country. That if you have dengue, it's almost like you have to get admitted. The reality is that's not always the case. I also think that we need the help of the media. I think that sometimes there's so much hype around it, and the reality is that I have to tell you, whether it's, and I'm speaking for Fortis, but I would say any hospital. I think that every hospital in this country, certainly I believe for Fortis, I know that to be true. But I think if any other hospital, whether it's Apollo, Max, Medanta, Manipal, in any hospital, I think everybody tries to do the right thing. We're all trying to heal. There is not a hospital in this country of any brand that wants to turn a patient away. We all want to do the right thing. I think we can create, and because there are lots of good stories that come out as well. And so I think that we need the government's help. I mean, and the problem is, the worst thing about dengue today actually is that we talk about dengue when it's here. We need to start having the conversations in June, July, in May, and start thinking, what are we going to do? How are we going to prevent it this year? So I think there's an infrastructure issue that the government has to support us on. I think that Fortis, like any other organization, I think we put our best foot forward. We can certainly do a better job again around building awareness and helping people to know what things to avoid, so that hopefully they don't get it as well.
Okay, talking about capacity building, I mean, India requires 6 to 7 lakh additional beds, over the next 5 to 6 years, and a lot of that demand is going to come from rural areas. Does Fortis have any plans for rural areas, tier 2, tier 3 cities?
So we have, certainly we have hospitals in Delhi, but we have hospitals in tier 2 cities, right? We have hospitals in tier 3 cities as well. Mohali would be a tier 3 city, for example. So I think beyond that, what we're looking at is we have an management contract model that I just referenced earlier. So we're looking at opening a couple of hospitals in Rajasthan that are actually in tier 4, tier 3, tier 4 cities. And we have hospitals coming up in other parts of the country that also would be in tier 3, tier 4 cities. So I think that you can look for Fortis to be adding beds. Are we going to add thousands and thousands of beds? Probably not so fast. I think we have to make the model work, because unfortunately a cath lab that might cost you a couple of crore, 2-3 crore, or any medical equipment that costs you 2-3-4 crore, costs you the same whether you use it in Delhi or whether you use it in some small tertiary or some small rural town in India. So the payer capacity has to be there. So I think that, again, we've been talking for quite some time about partnerships with the government, and certainly that needs to happen. So I think the 2 routes that we would take is 3 routes actually. One would be some partnership with the government, 2 would be management contracts, and running hospitals for others who may not have the skill set, the competency, the brand. And the third would be having a referral mechanism, so that in some cases we can actually get a patient from a rural town, actually bring them to even a tertiary city or a secondary city, so that they can get the care they need.
Is telemedicine something Fortis would look at, to bridge this gap?
We've been talking about telemedicine for the last 10 years, and quite honestly, it has not hit critical mass yet. I think there's a little bit of work that's taking place there. I think that, having said that, I think remote consults, right, which is what telemedicine is, it's not an if, it's when. And so we continue to dabble in it. We have a pilot running on dial a doctor type of thing, where you can call up a doctor and do a phone consult. So I think we're all dabbling in it. I think things like telemedicine will come, things like home care will come. I don't think that anybody's hit any significant mass with them. I think, but it's just a time. I think just a matter of time. Just like e-commerce, for example, if you look at the Snapdeals of the world, they've been around for a while. They've only now recently started hitting critical mass. I think you'll see the same thing here. Telemedicine will arrive in a big way. Remote consults will arrive in a big way. I just think it's going to take a little bit longer, but I think we're all dabbling in it. Just a matter of time before one day we'll read about the fact that they're taking off.
Okay. The Indian medical tourism industry is today pegged at $3 billion per annum, with tourist arrivals estimated at 230,000. Do you think there is any scope for stepping up this engagement?
Oh, absolutely. There are multiple efforts underway in the whole medical tourism industry today. We're partnering with industry associations like the CIIs and the FICCIs of the world, the NatHealths of the world, because there are 3 or 4 areas that we're focusing on. So one is from a visa perspective, and this is a partnership with the government that we need to make getting a visa, a medical visa, easier and simpler and lower cost for people anywhere. It's just this is one of the biggest complaints we hear, that it is it's painful in some cases to get a visa, so we have to do that. The second is that we're all looking at some sort of accreditation for hospitals, so that today it can't be just anybody can do surgery. That if you get a medical visa, that there should be some level of a minimum threshold or criteria that a hospital meets to be qualified to be able to treat that patient. So I think there's lots of effort going on. I think that we're building brand India. I think before we can go out and sell Fortis, we actually have to sell India first, then Indian healthcare, then Fortis. And I think the whole brand India piece, the Made in India initiative that the government has launched, I think is certainly helping. And I expect this business to continue to grow. I mean, I would tell you that most of our players in the healthcare space, this segment is growing by 15-20%. I think it's going to grow at that rate at least for the next 5-7 years, for the foreseeable future, because till now we're still only doing the neighboring countries. We're getting almost nothing from Western Europe. We're getting almost nothing from North America. Most of what we get is from the neighboring region. And I think once A, that business continues to grow, B, I think the geographical expanse and the reach will continue to get stronger. So this is going to be, whatever the numbers are today, you can assume and take to the bank the fact that these are going to double, triple, quadruple over the next 5-7 years.
And how is it that major hospitals in India are not known so much for their clinical research? How does Fortis plan to change that?
So we've actually formed, about 15 months ago, we formed a research board headed by one of our eminent clinicians, Dr. Upinder Kaul, who's a very eminent senior cardiologist in India today. And I think that one of the things that was hampering us was that the laws weren't very friendly towards research. I think that quite honestly that while everybody respects Indian doctors, I think there was this whole concern about the quality of data coming out of India. We're moving forward very aggressively. We have a complete vertical around research and clinical trials because they go together, and we are auditing our data, and what we're finding is that some of the work being done by our research teams, by our clinical trial teams is outstanding and as good as global best standards. One of our studies was recently published in the New England Journal of Medicine, which is the most eminent medical publication in the world today. So I think that this is a space that will grow. I certainly know, while I can't speak for other hospital operators or healthcare organizations, this is one of the key areas of focus for us. And I think that whatever your statement about the fact that we're not known for it today, I think if we were sitting here 18 months from now, you'd be asking me to tell you about the success of it, because I think that's how far we would have come by then.
You have often spoken about the challenges of healthcare cost, and you've said that an institution like Fortis has an important role to play in it. Can you tell us how? And do you think medical insurance and the availability, better medical coverage today can help?
Well, it's starting to already, right? If you think back again, my first round here, at that time the insurance penetration was in the mid-single digits. Today we're in the double digits in terms of penetration. So I think certainly the access and availability, as the insurance sector in India matures, 8-9 years ago, we didn't have very much history, so actuarial data was very limited. That's obviously, our database continues to grow. We have a lot more information available to us today in terms of patients' histories, predictability, some expectation on what might happen to people. So I think the insurance segment is going to grow quite substantially. I think from an affordability perspective, I think that we are working on partnerships, with the government. There are multiple locations in India today where we partner with the government to provide low-cost packages for different procedures that might be available. But in and of itself, even at Fortis, for example, I mentioned earlier about breast cancer, we're running 50% off on mammograms because we think that's important for us to be able to do. And so I think what you can look for is for us to take the lead on the whole awareness perspective. I think that's an investment that we have to make. I think from a screening perspective, you should look for us to be making an investment, and we are doing that, and we'll continue to do that. I think that when you start getting into treatment, I think we need some support, collaboration with the government to help us so we can do that. And what I can tell you clearly, and I speak on behalf of Fortis, but I would tell you that just about anybody sitting in my chair would tell you, is that if we can partner with the government, we're certainly willing to make an investment in that direction as well. I just don't know that the private sector can carry the entire burden. It doesn't anywhere else in the world. So I spent a good bit of my life in the US, and when you have programs like that, it's a good chunk of it is funded by the government. And I think we need some support from the government, but I would tell you that organizations like Fortis, we're prepared to do our part, and we will, and we are, and will continue to do so.
The government is doing a lot to make alternative therapies available to the people under Ayush. Does Fortis see any role in it? I mean, it is really helpful in towns and small towns and rural areas.
We are listen. We're all starting to dabble in that space right now. It's new even for the government. It's new. Having said that, there's an entire unorganized sector which is quite significant and large in India today in that space as well. So I think we're dabbling in it. Do I think we'll do more of it as we go forward? Absolutely. Is there clinical evidence that supports doing some of these things? Yeah, very much so. So I think that we're starting to dabble in it. We're exploring different things. We have one vertical in our organization called Mamma Mia, and Mamma Mia is actually about natural healing. It's about yoga and the effect that yoga can have on an expecting mother. So I think that things like that, but certainly homeopathic, Ayurvedic, different types of treatment, we're certainly looking at it, dabbling in it like anybody else. It's not significant yet, if you ask me to quantify it, but I think it'll grow. I don't know that it's not ever going to be more than clinical medicine, but I certainly think it'll have a role to play, and we'll certainly be participating in it.
And do you feel we are ready and equipped to have, cashless medical institutions, transactions at least?
Well, we're sitting here in the first week of December. If you'd asked me that question a month ago, I'm not sure what I would have said. But I can tell you now, we better, right? We all need to, with the demonetization that's taken place. And listen, we're talking to all the key players in the space who have platforms. There's the Paytms of the world and the MobiQuicks of the world. We're talking to the credit card holders as well. We're moving in that direction very, very quickly, right? I mean, there are scooter wallahs now who you can just scan your card and pay, so that's completely cashless. So I think that we're headed in that direction. We're running. We need to run because we need to provide good quality care. I think if it was 2-3 months ago, we might have had a choice. I don't think anybody has a choice. So you have a choice, which is either get on the bus or miss the bus altogether. So we're on the bus, we're in the front seat, and we'll be making all sorts of platforms available.
And do you think profit and healing go together when you say margins will be increasing?
Absolutely. I think one enables the other. Because the reality is, and this is public information, Fortis is not profitable. If you're not profitable, how can you invest? How can you invest in technology? How can you invest in equipment? The best hospital operators in the world are some of the most profitable hospitals in the world. And we're investing in research, we're investing in trials, we're investing in new equipment, new technology, new infrastructure. I think that clearly, if the only thing that Fortis stood for, or any organization stood for, was about making money and nothing else, then I think you should be held accountable for that. Having said that, in the last 15-20 minutes, we've talked about medical equipment technology, we've talked about investment, we've talked about raising awareness on breast cancer, we've talked about organ donation. If we do all of these things, we talked about research and trials, it's only having a viable business model that supports those things. The reality is that if we were not making a profit, we couldn't do any of those things. And then the question you'd be asking me is, why aren't you doing those things? So I think one enables the other, and actually they go hand in hand, and that's not a bad thing. I think the idea is that continue to be good for the country, continue to help build a healthier nation, a more knowledgeable nation, and then I think it makes a lot of sense, and then I think they do go together well.
Okay, that'll be all, Mr. Singh. Thank you so much.
Thank you.